Joining us now is Global Ambassador of the Cervical Cancer-Free Nigeria campaign and President of the National Council of the Nigerian Stock Exchange, Otumba Abimbola Ogunbanjo, joins us now virtually. Thank you for joining us on the News at 10.
Thank you for having me.
We just heard Mary's report, and it paints a bleak picture of the treatment of cancer, especially here in Nigeria. How troubling is the case in the country, and cervical cancer in particular, for which you are a global ambassador in a campaign to make Nigeria cervical cancer-free?
Well, you're probably aware that Nigeria is a middle-income country, albeit it has the largest economy in Africa. Most unfortunately, despite our wealth, strong educational system, and cultural richness, the rate of cancer death in Nigeria is high and steadily climbing. Lack of cancer prevention efforts and cancer screening opportunities, which prevent cancer or catch it early before it has, had a chance to spread, means that most Nigerians who develop cancer miss the window in which the cancer can be cured. They present to the doctor or hospital when it is often too late. Very advanced cancer, suffering in pain, and with very few options. In the case of cervical cancer, over 95% of all cervical cancers are caused by a virus called the human papillomavirus, or HPV. This virus is very common. About 85% of all people in the world are infected with the virus at some point in their lives. So only a subset of people who get infected will get cancer. The most common HPV-related cancer is cervical cancer. And in many countries, the rate of cervical cancer deaths is extremely low. These countries have achieved this low rate of cervical cancer death in two ways. One, they prevent HPV-related cancers by giving children a vaccine against HPV. This vaccine is one of the safest and most effective vaccines in the world. Two, they screen for cervical cancer so it can be caught early, the time when it can be cured with relative ease. Unfortunately, in Nigeria, we neither vaccinate for HPV on a broad basis, nor do we routinely screen for cervical cancer. This is why over 10,000 Nigerian women died of cervical cancer needlessly last year. This is my goal, to stop this cancer in its tracks. In my lifetime, I'm committed to eradicating cervical cancer in Nigeria.
And what has been the level of collaboration that your organization has received from governments and the private sector in investing in access to treatments and care for victims of cancer?
Well, to address such a dire and large problem requires effective and efficient collaborations. Our campaign is coordinated by Global Oncology, US-based nonprofit organization that works all over the world. Other partners have included members of the Nigerian government, Nigerian nonprofits, entertainers, writers, journalists, health advocates, and business leaders. As a grassroots effort, we've shown that we can accomplish amazing things in the realm of cancer education, raising vaccine awareness with relatively limited funds. Now is the time for additional collaborators to join our efforts and for all of us to double down on our commitment to the health and well-being of all Nigerians. We have it in our power to eradicate cervical cancer in our lifetimes. It would certainly be a true tragedy if we do not seize this golden opportunity.
And just for the sake of putting this information out there, how often should people screen for the various cancers, or is one screening just enough for the whole year?
Well, right now, the HPV vaccine is available in a limited capacity in private hospitals. This means, regrettably, that only those of significant means have access to the vaccine, whereas the vast majority of Nigerians who depend on government-supported vaccination do not have access. So part one of our campaign involves supporting the planned national rollout of the HPV vaccine. as per the National Cancer Control Plan. The HPV vaccine was to be rolled out nationwide in 2021. Of course, when that plan was put in place, no one could have known that we would be in the middle of a pandemic. Yet, on the heels of a very successful poliovirus vaccination campaign, we anticipate a potential joint HPV COVID vaccination campaign to be equally successful. Part 2 of our campaign involves educating Nigerians about cancer, as well as the safety and efficacy of the HPV vaccine. Education is much more palatable and memorable when it is entertaining. Thus, we've developed a comic book and a very exciting 10-minute comic book video that teaches Nigerians of all ages about these important health awareness topics. Anyone can access this video on our website, cervicalcancerfree.org, and can easily learn about these topics. Hope with appropriate support and funding to translate the comic into local Nigerian languages, including Hausa, Yoruba, and Igbo, and are working to distribute the video widely through national and international avenues.
Thank you so much, Otumba Abimbola Ogunbanjo, for bringing more awareness to the issue of cancer and, of course, advocating vaccinations for people in Nigeria.